And remember, your eyes are always where? On the casualty's eyes.
The ability to quickly and confidently respond in an emergency can save a life or prevent further injury. Having these skills or more awareness of accident prevention empowers us to protect our loved ones.
To mothers, one, if you have a nanny, let the nanny take a first aid class. This is probably with the pediatric first aid that deals with babies. It really saves out.
As a first responder, the first thing you should do is to secure your own safety. In the event that the victim collapses or becomes unconscious, the first step will be...
So you need to check if the casualty is conscious or unconscious. So by doing this, you're just going to tap to the shoulders. Hello, hello, can you hear me? Hello, open your eyes. If not so, you can give a pinch to the ears, or you tend to do the sternum rub. If you see the casualty is not responding to this, you need to shout out for help so that people can come and help you, and others may help you to make a phone call.
If the heart stops pumping, it is known as a cardiac arrest. Cardiopulmonary resuscitation, CPR, is a combination of techniques, including chest compressions designed to pump the heart to get blood circulating.
So you open the airway, then you check up on breathing, and immediately you find that they're not breathing, you're just going to locate the heart and start up on chest compression. So interlock your arms, make sure your arms are straight. So from there, 1, 2, 3, 4, 5, 6, 7, 8. It is a continuous process, okay? Until now the casualty tends to do what? To regain their breathing. That is when you're going to stop CPR. That is for an adult, for a child, 1 hand supported. For babies, 2 fingers.
When blood stops circulating, the brain is starved of oxygen and the person quickly becomes unconscious and stops breathing. Without treatment, it can be fatal.
What if you find a casualty is not breathing? Okay. So the first thing you're going to start off is checking response. Hello, hello, can you hear me? If they're not responding, you open the airway, then again check up on breathing. Now, when you find they're not breathing, you're not going to check up on circulation. You immediately need to start doing what? The CPR, okay? We have ways on which to locate the heart. So the easiest way is from the armpit straight. Next to the sternum, or just above the sternum, that's where you're going to do the chest compression. Now, when you're doing the chest compression, make sure that your chest is straight to the casualty's chest.
The other most common accident is choking in children and adults. If the parent or caregiver has knowledge on first aid, they are able to administer it on their way to hospital, giving the child a better chance of survival.
You're going to give back blows in between the shoulder blades. 1, 2, 3, 4. In between the nipples. Press as you go upwards. 1, 2, 3, 4, 5. Keep on checking. You'll keep on repeating the procedure. If you do it 4 times and it is not becoming clear, okay, transport, now start thinking of going towards a hospital facility.
And in the case of an adult,
imetoka. Because she's a lady, you're just going to ask a simple question. Are you pregnant? Now you're going to locate the navel and the diaphragm. So in between the navel and the diaphragm, in between there, that is where you're going to give abdominal thrust. So 1, 2, 3, 1, 2, 3, 1, 2, 3. You're going to do it 5 times.
As Kenya joins the globe in commemorating World First Aid Day, medics have underscored the importance of organization training their staff on first aid skills, as well as encouraging at least one person in every family to have knowledge of first aid.
In case of an emergency and you do not know what to do or what action to take, kindly call St. John Ambulance. We have qualified paramedics on ground. They will give you guidelines as others are being dispatched towards where you're coming. So you'll have a guideline to the time when they get there and they pick it up from there.
Gigi Namagundu, K24, Nairobi.